Hi, I'm Michelle Bluestone.
Hi, my name is Ashley. I'm going to be doing the interview today. I understand that you're applying for the registered nurse position.
Yes, ma'am.
You understand you're going to have to work overnights, correct?
Yes, ma'am.
Okay. All right. Let's go ahead and get started.
Okay.
Tell me about a time when it was flu season and you found your floor understaffed. How did you ensure adequate staffing?
There was a time when our unit was understaffed. It was RSV season and the floor was full of infants struggling to fight the virus. I had 2 nurses call in for the same shift. I was so overwhelmed and began to panic. I had to stop and take deep breaths and assess the situation more thoroughly. I was able to make a quick decision to call down to the ER and ask for their available nurses to come and help assist with our unit. Thankfully, they sent them right away. I learned in this situation that I will have a better outcome when I stay calm.
Okay. Tell me about a time you had to work closely with the treatment team. What was some of the conflicts you faced and how did you resolve them?
Differences are unavoidable when people work together, as a team especially. Eventually, people will encounter these differences. There was a time when me and another team member had a communication barrier. We had an uneven conversation about her patient's treatment plan. I disagreed with her, and she was very confrontational about the situation. I calmly discussed with her that how her treatment plan was a great idea for a different patient, but for this patient, this particular individual, it was not. I was able to help her calm down, and I explained to her the major complications that could arise from her treatment plan. She then understood and agreed, and I learned that as a nurse, there is always an opportunity to grow.
Okay. Tell me about a time you had to observe and analyze a patient's behavior. How did you document and report these observations to the attending physician?
Patient observations are vital when trying to find a prognosis for a patient. I can recall a circumstance where a patient's behavior was changing very rapidly, and this patient was showing signs of distress. I was very thorough in my documentation, and when it came time for me to report my observations to the attending physician, I was very clear and detailed. I let him know the key behaviors that I thought were red flags and discussed other small details very briefly, as I know just how valuable his time is. And by being very thorough, the physician was able to provide the correct treatment in a timely manner for this patient.
Okay. It is sometimes difficult to perceive the impact of an illness or hospitalization on a patient's life. Tell me about a time when you were able to step into another person's shoes to understand how they were feeling. What did you do or say in that instance?
I think one of the hardest things to see as a nurse is the pain a diagnosis or a prognosis can impact a patient. I remember a time when I had a mom receive the diagnosis of her newborn baby. It was very hard to keep it together, but I knew that being strong for her was what she needed most at that time. And as hard as it was, I kept my composure. I was sympathetic and patient with her, and I learned keeping your emotions under control is vital in situations like these.
Administering medication plays a huge role in your job description. Tell me how to ensure that your patient is administered the correct medication and dosage.
Administering medication is one of the most important tasks as a nurse. It's vital to always be clear about the patient's medication and dosage. There was a particular incident where I was going over the patient's medication, and I noticed that the dosage seemed a little high for this particular patient. So I brought it to the attention of my charge nurse, and thankfully we were able to get it corrected. I learned to always triple check the medication, dosage, and the patient's name before giving each patient their medication.
Tell me about a time when you had to make a quick decision about patient care. Describe the basis for your decision and what the outcome was.
There was an incident when I had a patient come in. He was very pale and slurring when he spoke. I immediately knew something was wrong. I checked his vitals and noticed his blood pressure was extremely low, as well as his oxygen saturation levels. I quickly notified the rapid response team, and upon arrival they were able to determine that the patient was having a myocardial infarction. Thankfully, they were able to get him to the OR for surgery. By making that quick decision, the patient is still alive today.
Describe a situation from your past work experiences in which you had to use your skills to effectively communicate with other staff members.
As a team, we must communicate effectively to ensure the best care for our patients. I remember a time when I had to describe a patient's plan of care to the entire interdisciplinary team. I was very clear and straight to the point. I had a great outcome, and everyone had the knowledge needed to care for the patient.
Tell me about a time where you had to handle a patient in crisis. What type of therapeutic interactions did you use?
There was a time when I had an outraged patient that did not understand his procedure that he needed. He was very agitated and just having the hardest time. He did not want to understand what I was saying. I was trying to use clarification, but he just couldn't get it. He couldn't grasp it. So I began to ask him different questions. I directed the conversation in a different direction to calm him down a little bit. He quickly calmed down as we stopped talking about the procedure and began to talk about something he was way more interested in. I learned that day to always be patient and be kind to patients who don't understand what's going on.
Okay. Tell me about a time when you had to train other employees. What was the outcome and what did you find most difficult?
At my first job, I remember when they asked me to train a new employee. I was concerned because I had never trained anyone before. I will never forget what a disaster the first day was. The woman I was training was the complete opposite as me. I went home feeling so defeated. The next morning when I arrived at work, I felt optimistic because I had taken some of my own time to research leadership skills. I realized that I had gone into this with the wrong perspective and that everyone learns differently. By realizing this, I was able to successfully train new employees going forward.
Okay. Since patient care is our top priority, can you give me an example of a time when you had to assign your staff to meet the need of every individual's patient care?
Some clients' needs are relatively predictable, and other patients' needs are unpredictable as based on the changing status of the patient. Some needs require high levels of professional judgment and skill, and other patients' needs are somewhat routine and without the need for high levels of professional judgment and skill. There was a time when I had to assign my staff according to each patient's needs based on the ability of each staff member. Although it was a huge learning curve, I was able to suit each patient with the staff that I felt was best for their care. In the end, I had a great result.
Okay. That will be it today. Thank you for coming.
Thank you.
Okay.